can't handle this. Stop judging me. Why do I even try? I just want to talk to someone.
No one gets me anymore. Why can't I just be normal? What is normal?
Would anyone even care if it disappeared? I'm not good enough. Why can't I be like everyone else?
My kids don't understand me. Am I crazy? I'm not good enough. I can never do anything right.
I just want the voices to stop. Sometimes I just lose it. I just want to talk to someone.
My name's Doris, I'm 51 and I have bipolar. At the age of 40, I had my first episode. I'm not a monster, I'm just a human being, and there's plenty of us people out there. Bipolar is either being manic or being depressed. So when you're depressed, you're in a hole that you can't get out of. No matter what you try to do, you can't find anything happy about it. There's nothing that you can see or any reason to survive. Depression's probably the saddest part and the hardest part of bipolar. I had a friend tell me just the other week that he tried to explain to his best friend who couldn't understand depression. He went around poking his friend and saying, kill yourself, kill yourself, kill yourself, kill yourself, kill yourself. And his friend said, what the hell are you doing? He goes, well, just imagine that for 24 hours, 7 days a week. That's what depression's like, and I can't control it. No matter what I do, no matter how much I try to say stop, I don't have any control of this voice in my head. And on the other side, being manic is, there is nothing I can't do. I can build a house, I can build stairs, I can be everywhere, and I can do everything. That burns me out and my family.
LRH is the main provider of mental health care for the entire Gippsland region. Over 1,000 people across Gippsland receive mental health care at any one time, with 450 referrals a month.
My name's Kate Hopner and I'm the Director of Mental Health Services at La Trobe Regional Hospital. The responsibility for mental health issues sits with all of us, not just mental health services, not just schools, not just workplaces, not just the medical profession, but all of us as a community. People with mental health issues are just like you and me. We're all just human beings and we all want to be connected to the world and have meaning in our lives, and that's what everyone wants. Suicide rates in Gippsland are higher than the Victorian average and higher than the national average. I think it's really sad that suicide kills more people in Gippsland than the road toll and drug overdoses, and we don't talk about it. It tears apart families, schools, workplaces and communities, and people don't seek help when they need it. And as a community, we need to talk more and have people connected to our community to reduce the suicide toll.
I never thought that I was a depressed person until my sisters and my family reminded me of when I used to actually go out with a police officer when I was living in Melbourne, and I had rang them and I had his gun to my head and said to them, I don't want to live anymore, I want to die. And the fear that they had, that they were living so far away from me that they could not help me at all, and I couldn't help myself. I've been in hospital twice with different psychotic episodes. I was at the stage, my last episode, where for 2 years I was not functional. I couldn't cook a meal. I didn't know if the meal was cooked. I couldn't go shopping. My 2 girls helped me with all those things, and my sister was my saviour. She was with me every day, pushing me to do things and move on with life. I am here now, 5 years later, fully recovered. When I say fully recovered, I take medication every day so that my mood is stabilised. It's not something that I'm in control of or something that I can switch on or off. It's something that I can evaluate my triggers. If I'm not sleeping well, I will make sure that I get a good night's sleep, or else I could go into an episode.
People who require a hospital stay and more intensive treatment are admitted to the Latrobe Regional Hospital's Flynn unit. It's the only inpatient facility in our region.
People might ask, what can they do? How can they help? So we've decided to set up a community project where we're redeveloping our courtyards in the Flynn unit. The courtyards are really drab and unpleasant. So now we're going to turn those courtyards into sensory gardens where people will feel connected to the environment, and that will assist them in their mental health recovery.
I see the need for making it a place where people can feel comfortable, where there's a garden growing. At the moment it feels a bit like a jail, and I know that the hospital staff try to do their best at it, and they can't change what the outside looks like. We can, you can. Please help us to help them find a better outdoor area, because you will make a big difference in their lives.
You can make a difference. All it takes is a little generosity, and you'll help local people on their road to recovery.
I'm very happily married with my 2 children, 18 and 21 now. We live a normal life. My kids know when I've got too much on my plate, but it's about knowing what my triggers are and when enough is enough. I work in an office doing bookkeeping, and now at LRH as a consumer consultant in mental health, helping other people with mental illness. We need more assistance. We need to help people like myself so we can live a normal life, not one of despair and of just existence.